Hi guys, welcome to my channel. My name is Enorita James. I am a clinical research scientist of over 22 years experience. Today I'll be talking about the understanding the hormone receptor status of cancer cells, especially breast cancer cells. Now, why is this important? And what exactly do I mean by hormone receptor status of breast cancer cells? For you to be able to understand this, I have a video which I will link towards the end of this video on what exactly is cancer. How does it form? How do the tumors grow in our organs, especially in the breast? I also have another video that I talked about different ways or different kinds of breast cancer. When somebody says he's diagnosed, or when somebody is diagnosed of breast cancer and another person is diagnosed, most times it's not the same. And because of this, it is good for you to have an understanding. And the reason I do these videos is because I have gone through diagnosis, I have gone through treatment, and I've been living my life to try to prevent a reoccurrence. So I want to put all these experiences out there for somebody that might be going through the same thing, so that you know that there's always a way. It is not always the end of life when you're diagnosed of cancer. So what exactly is hormone receptor status and why is it important? Hormone receptor status refers to whether or not cancer cells have receptors of some particular hormones in your body. Now, if those cancer cells are seen to have receptors for estrogen, the normal result you will see on your histopathology result is what is written as ER positive. That means the cancer cells that is growing are estrogen, have estrogen receptors. That means they are estrogen positive cancer cells. Now, if it also has a result like PR positive, that means they are also progesterone receptor positive. Progesterone is also a hormone. So if you see something like ER positive, PR positive, it means the cancer cells are estrogen receptor positive and progesterone receptor positive. Now, what does this mean to your clinician or to your doctor that is handling the case? This will help the doctor to determine the treatment path to give to you or to anybody that you know was diagnosed of this breast cancer. So understanding hormone receptor status of a breast cancer is very important. That is why a biopsy is normally done. If you don't know what a biopsy is, I think I explained it in this video. I'll link it right there. My video on the different kinds of breast cancer that one can be diagnosed of. So it is through this biopsy in the histopathology lab test that makes the physician to know what kind of therapy to give to you. That is why it is so important. Now you understand what is ER positive and PR positive hormone receptor cancer cells. There's another protein to be aware of in the histopathology testing during a biopsy, and that is what is called the HER2 protein. Now, what is HER2 protein? This is a kind of growth-promoting protein. If a biopsy is done and in the result it is written HER2 positive, that means this particular kind of cancer that is HER2 positive is a fast-growing cancer cell. They multiply very fast if it is HER2 positive. So when one has HER2 positive result, it is not normally a good prognosis or diagnosis because it's a cancer that will grow fast. Now, if you have just the ER positive and the PR positive and the HER negative, that is a good prognosis because most of the drugs or the hormone therapy when it comes to treatment will be based on trying to ensure that these cells do not get estrogen or progesterone. And that is the basis of most anti-hormone therapy for cancer of the breast. And that is also the basis for most of my videos where I talk about cancer of the breast prevention through nutrition, where I tell you foods that can mimic the drugs that is given to you when one has this hormone receptor positive breast cancer. So that is why I'm taking my time now to explain what is what hormone receptor positive or negative breast cancer is. Because later, if you listen to my other videos, when I talk about the different kinds of food that you can eat to prevent cancer or different kinds of food that you can eat to prevent reoccurrence, if you have ever been diagnosed or if somebody that you know has ever been diagnosed of breast cancer. Now, there's a third kind, which is what is called the triple negative breast cancer. This simply means that this particular breast cancer is negative for estrogen. It does not have estrogen receptors. It's negative for progesterone. It does not have progesterone receptors, and it's negative for the HER fast-growing protein. This kind is also a very aggressive kind of cancer. So if you see something like TNBC on your biopsy result, that is from the histological laboratory result, it simply stands for triple negative breast cancer, TNBC. Unfortunately, 10 to 20% of breast cancer diagnosed falls in this group. And this group is one of the most aggressive kinds of breast cancer. I hope that this has given you an understanding and it will not look so strange to you if one way or the other you come across such a result, or if you are diagnosed of cancer and you have to do all these histological tests, you will have a better understanding when you get to look at the results. In my next video, I'll be talking about different kinds of breast cancer treatments that are available. And I think you should watch that video. Because believe me, when you watch that video, you will not want to go through such treatment. You will prefer to do things that will prevent having the breast cancer at all. Thank you so much for listening. Until my next video.